Hello dear patients, today we are going to review the case of warts on foreskin, multiple warts that appeared on foreskin after removal. The patient came to dermatovenerologic dispensary at the place of living earlier, where condylomas acuminatas were diagnosed to him. There were about 5 condylomas acuminatas there. They were small. A removal by liquid nitrogen was prescribed and Isoprinosine was prescribed. No analyses were taken. In about a month, condylomas started to grow actively, and in 1.5 months he came with a picture that you can see on the photo. Indeed, the number of condylomas increased about 10 times, and they grow quite aggressively. So we took analysis from the surface of these condylomas and from inside the canal for human papillomavirus. Human papillomaviruses of 6th, 11th and 44th type were found in high concentration. The concentration was more than 10 to 6th power. General blood analysis and immunogram were taken, where the significant change of immunity was found. Immunologist prescribed a corresponding treatment, and for this particular patient, with his Immunogram, Ingaron and ozone medications were prescribed. On the background of this treatment, the removal was done. The removal was done by radiowave method with anesthesia for 2 times, with a week interval in between. In the first week, the main part was removed, then an additional removal was done. The patient was observed for a month, while he was getting a treatment. Later on, there was no relapse of these condylomas acuminatas. However, human papillomaviruses of 6th and 44th types remained during an additional taking of material in 2 months. Immunogram was taken again, and the repetitive course of treatment was prescribed. After that, approximately in 1.5 months, a repetitive analysis was taken, and only one type, 6th type, remained in a low concentration. This is about an issue that many patients consider human papillomavirus to be incurable. Indeed, its treatment is quite difficult. However, it's quite achievable, and many patients who come to us, do analysis and get a corresponding therapy, are able to completely heal human papillomavirus. Therefore, there's nothing supernatural here. The only thing is that without analysis and using a rule of thumb, if isoprinosine tablets or some anal suppositories are prescribed, then indeed it's not possible to heal human papillomavirus. If you want to heal it that way, then indeed this process is incurable. It's most correct to do removal secondary to treatment, particularly during an aggressive growth, as this stops the growth and dissemination of virus, and secondly, the treatment has to be chosen with consideration of immune status. If it's necessary to diagnose, remove, and treat any rashes, including condylomas acuminatas in the area of sexual organs, you can consult urologists, venerologists and gynecologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such neoplasms. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.